At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome to this very special episode of GLI Live, our thought leader interview series. We are focusing on some very special people and issues throughout this month of October. Focused on liver cancer, as we do, because October is for livers, and it's our opportunity and our privilege to unite the global oncology and healthcare communities around public awareness, policy, and clinical needs and solutions in liver cancer. And so with me today to discuss how we change the narrative around issues in liver cancer, as well as HIV and transplantation, we have a fantastic fellow survivor with us today, Mr. Morris Murray. Welcome, Morris.
Hello, Donna. Glad to be here.
Thank you so much. So we have a lot to unpack in our short time together. And so why don't we start with the first diagnosis? We learned about you as you're featured in your hometown, one of your hometown papers, Baltimore Banner, about your struggles with HIV and a hepatitis C diagnosis. And so tell us about how your journey began.
Well, it began early in the 80s when AIDS first came out. I'm 64 now, so I was about 21 during that period. And as you know, there was nobody knew anything at that time.
Right.
And I didn't get tested till 1987, primarily because there was no medications or anything before that. So I got tested at that time, and I tested HIV positive. And during the course over a couple years in the beginning there, I was taking AZT monotherapy. It was the only thing around at the time. And I did that for 9 years. But as I was going for my doctor's appointments regularly, they were doing other testing. And it was sometime around early 90 or so, 91, that they came back and they said that I had tested positive for what was non-A, non-B hepatitis, which eventually they would name hepatitis C. And at the time, it was believed to be dormant, and it didn't seem like a concern, especially for me at that time, because I was more concerned with the HIV and, getting treated for that. So at that time, I really didn't have any symptoms as far as my liver, other than being told that I was HCV positive. And then in the later 90s, when the new drugs came out, the heart drugs, highly antiretroviral drugs, I started taking them. And during that time, I also saw an ad in one of our local papers here, the Baltimore City paper, which used to just be a weekly. In the back was an ad that had, they were looking for volunteers for a clinical trial that would be the first around that would try interferon and I think ribavirin in people with co-infected with HIV and HCV. And it was a worldwide study called the Apricot study. It was a big study. I was very happy to get into it. And during that period, 99, part of it was you had to have a liver biopsy and everything. And my enzymes had started to go up probably in the late 80s, late 90s. But they were like maybe twice. So it wasn't real harm, but we knew something was going on, and we figured it was the medication. But when I went for the protocol for the clinical trial, it was determined that I had stage 4 cirrhosis, stage 4 end stage liver disease,
Wow.
cirrhosis. And I was shocked because at the time I was still working full time.
Mm-hmm.
I was organizing the Baltimore Gay Pride Festival, which is a pretty big event.
Yes.
And we were also I was chief shop steward at the track, so we were in negotiations at the time.
Mm-hmm.
I was healthy enough to be doing all this.
Mm-hmm.
So I was really shocked with the cirrhosis diagnosis. So I went ahead and I got in the study. And unfortunately for me, I did not respond. It was a 48 course of the treatment. And after the 48 weeks, I was still had C. But the good thing was in the study that it did prove that 60% of people responded to the treatment.
Mm.
And since then, we have much better drugs to treat.
Absolutely.
Yeah, that cure it much more easier. I eventually was cured in 2011, and they don't even make that drug anymore because they were pretty nasty as far as it, but it's worth it in the long run.
It's so important to for people to hear sort of the arc of medical history that you and I have both been involved in, to give them hope when for many liver diseases there aren't yet cures, there aren't yet effective treatments, and I know from several patients it can be very frustrating, but having remembered when my transplant drug was called FK506, it was just starting and is now the standard of care, or having gone through multiple IBD medications, and I can see, or I've been able to see evolving, medical science. And you too have been the beneficiary of evolving medical science and a participant in it. And I think that's another important point, that without patients who are willing to step up and to stand up and participate in the development of the medical science, it can't happen. It can't happen.
I wholeheartedly agree. I mean, we have to step up. And I know sometimes it's very difficult with the sicknesses. But one thing I will say, where I was getting treated at Hopkins, which was the Moore Clinic then for my HIV. And in the early days, it was like a triage in there. It was people from all different stages of illness that would come in. And there was fear. There was, because, is that going to be me in a couple months? But we all dealt with it. And it became a camaraderie. And it was like we all worked together. If somebody was starting a new drug, we supported them, like, oh, I took that, blah, blah, blah.
Right.
And it was like, it was really a support group. If there was drugs coming out, we talked about it in that waiting room while we're waiting for appointments. And it was just such a good resource center. And I learned a lot then, and just how to navigate to get there, and the system to go and see about your care. I mean, to see if this will work for me. And even if it doesn't, at least you've
contributed to the science. You've helped someone. And I also think that the attention and the care that you get as part of a clinical trial is sometimes underrated, because you really they pay very close attention to you, and you have a frequency of visits that you wouldn't ordinarily have if you weren't part of a clinical trial. And so I think that's something that people need to know about as well.
I do too. I mean, I agree. I think part of the reason that I've done so well is that I always stayed involved in whatever clinical trials. I'm still in, I don't know how many now. I mean, a lot of them are just drawing blood and storing for that purposes. But I'm in 3 COVID studies alone because I had COVID. I was one of the first with a transplant here in Baltimore to get COVID. So they were, yes.
They should have done a side by side, because until last week I had avoided COVID, and so it's a wonder with the number of immunosuppressants that I was on that I skated through. So what is it about my immune system that repelled COVID?
Yes, that's how I felt. I was diagnosed in May of 20 before any medications or anything came out.
Right.
And because I lived with a pharmacist and he had to go to work, he tried to kill me, Donna, but he didn't. But anyway, but yeah, it was, I felt the same way. I was like, how did I get through this? And I think I really didn't know I was sick till almost the last 2 days that, I just thought I was dragging. So I didn't really have a lot of the respiratory issues and all. Thank God. I was lucky.
So, you have had we left when we left the story, we were on to cirrhosis and stage 4 liver disease. And so how did you discover that you had developed liver cancer? Were you being monitored regularly, and what did that monitoring look like?
The monitoring, I was started monitored because I was in the trial in 2000. And then in 2003, I went back. It was another trial for the non-responders of the first trial. So I tried that again, but I only lasted 26 weeks. I was just too debilitated at that time. Neutrogen, all that, just taking everything. So I couldn't complete the course that time. And it was after that that my liver enzymes really started to go up and they started to monitor. And I was getting either a CAT scan or MRI at least once a year. And then towards the late 2000s, they were start doing them every 6 months just to keep it checked. And that was 2011 when I was, 2012 was when I was diagnosed with the liver cancer. And 2011 is when I was cured of the Hep C. Between that period, from 2000 to the whole 2000s, I was pretty much, I was sick. I had done the trials and everything. But I also, one thing, I don't know how much good it did, but I was very conscious of whatever went through my liver to try to make it last. I would always wear gloves if I used any kind of detergent, put any colognes on or anything like that. Anything that I thought was going to seep in and do damage, I stayed away from.
So let's talk about that a minute, because I think most people, even when they're watching this program, don't really recognize all the things that the liver does. And part of that is filter out environmental toxins. And so sort of everything that you're taking in through the largest organ of your body, your skin, gets through the second largest organ, which is your liver. And so what you eat, what you drink, what you're breathing, what you're touching, can have an effect on your liver, or just make more work for your liver. And so you were just doing everything you could to sort of ease the burden on your liver while it dealt with these other very serious things.
Exactly. And I
think that's a good strategy.
Yeah, try to stay away from processed food. And I found I like plenty of other food.
I think that it's great that you approached it like I do, is not either or, either, sort of a holistic, natural approach or the medicine, that they're really complementary, and that you want to give the medicines the best opportunity to work by doing what you can for your system. And so I think that sort of balanced approach, more patients should consider.
Yes, I agree, because I do think it helped. I mean, I think it, I was a long time on the wait list and also,
right.
And I do
what you can. You control the controllables is what we often say.
Yes. Because there's so much we can't control.
Absolutely. And so I'm sure that made you a really great candidate for transplantation. All of the things that you were already trying to do for yourself. I wonder, which was harder, either from explaining it to your family or your community, perspective, which has the greatest stigma, or which was, harder to navigate, the HIV or the HCV or the cancer, or the transplant, and our fragmented system. Each of them has different structures and setups and cultures. Which was hardest for you to navigate?
I imagine the HIV in the beginning, when nothing was known about it,
Right.
was the very hardest. And then when we did start to find out things, and I was diagnosed officially, I always had friends that in the community, in the gay community, and I had a roommate at the time where I always told them. I had a partner at the time. I told him. I didn't tell my family, mainly because not that they wouldn't accept it or anything, but I had 3 people there. My godmother, who I was really close to, my mother, and my father all died of cancer from 1988 to 92. They all had terminal cancer, and it just wasn't a good. It
wasn't a good time.
Yeah, they had their problem, but they would have never disowned me or anything. Like, I was very fortunate, and I never had to worry about that. That thought never. So I always had some support, because either friends or my partner or something like that. As far as at work, I kept that quiet for the most part. But then after my parents died, not that, I didn't really care who knew after that. And I went to HR at where I worked and told them. And then it was people at work, how coworkers are, that's all over the next day. So it was like, so it's like people learned. At one of the shop steward meetings when we were in negotiations, I told them at the time, just, so all the officials would know. And I never really had a problem at work. They were always very supportive. Well, until the end, till the end, I should say. Yeah, when I needed the liver transplant, they were the administrator of the plan. So they denied the liver transplant. It got a little rough towards the end, but it all worked out. We sued them. Well, we got it.
Sometimes that needs to happen. That's why we have lawyers. Why we are lawyers.
They were denying it because they were claiming it was experimental. And this was in 2000. I forget what year originally, when the 2005 or so. But it did stay experimental, yes, on the plans for a very long time. I was transplanted in 1994, and so yes, by the 2000s, that really should have gone away. And you've been involved in other legislative and advocacy movements. I was really intrigued to read about the HOPE Act. Yes.
And so tell us about the HOPE Act.
The HOPE Act is the HIV Organ Policy Equity Act. It was signed into law by President Obama in 2013, and I think it was implemented in 2015, where they started doing the transplants. And this is for people who are HIV positive, like myself, that if I want to donate an organ, that someone who is also HIV positive could receive that organ, as long as they're eligible. Which opens up more organs for everybody, because if the people with HIV are given to people with HIV, then if another organ came along, that can go to somebody that doesn't. So it's really a great thing. I mean, and we just have to get across that it's there now, and that we have it, that we have that opportunity. For so long, it was just, gay men couldn't give blood at all.
Right.
Where those are changing, and let alone given an organ. So I think really now, if we work on the younger generation, because the younger generation, I mean, even in my community, I go to the dog park every day, twice a day. I've made friends, lots of friends from different ages, which I love. They're in their 20s, they're in their 60s, and we're just friends. We go bowling, we go to trivia, we do all kind of things. And they all know my story. They read these articles and everything. And it's like, I find the younger people are much more accepting. And I think if we can get the word out to them, that they can spread it, that they know that organ donation is they'll carry the word. At least I hope so.
Absolutely. I remember being a young attorney and being across the table from an HHS official when the first pilots were starting to have HIV to HIV organ transplants.
Mm.
And they were legislating, they try to put policies in. I was like, it's already happening. He's like, what? It's already happening. He's like, no, it's not. And my boss had to back me up. Yes, she's right. It is already happening. And they were like, okay, we'll table that for a minute. And so I think that as this became more science-based rather than fear-based or stigma-based, then things could happen and make things available. Same with hepatitis C cures, making hepatitis C to hepatitis C transplants available. There are extended donor criteria for age. And so I think transplantation is a lot more accessible than it has been.
I agree.
Not nearly enough, but
Mm-hmm.
we're making a lot of progress with the science. And if the policies can match the science, then we're all the better for that.
Absolutely. I mean, we need the policies, and we have them now. I mean,
Right.
it's through June of 2023, we've done 396 transplants through HIV to HIV, and that's out of 208 donors. So that's a good start, but I think we can do much more, much more progress. And it's supply and demand. Once people start wanting it, it'll be more transplant centers that do HIV transplants. So we're at the beginning process, and I just think we need to promote it more. And once people know, I mean, it's been 10 years. I can't believe, 10 years.
Congratulations.
It's just amazing that, I wouldn't be here.
Right.
Yeah.
So what other things can we do as a larger liver community to support our LGBTQIA plus friends around the world? Certainly in the US, but around the world, there's stigma and lack of access, and we want to make sure that all of the evolving liver therapies and transplantation therapies are available for everyone who needs them. So what can we do to be better allies?
Well, we need to we need the funding to provide the help that we need. It boils down to resources and just getting the word out. I mean, if globally, I'm not sure, I'm not that familiar with all the policies of the globe, how we do. But I think with everything, it just boils down to making things normalized. I mean, we just, the more that people say, hey, that's what you do,
It's our friend from the dog park.
Yes, I mean, it's like, look at him. He went and got a liver transplant, and he's got all kind of things wrong.
Exactly. I have to admit, I mostly only know my neighbors who have dogs, and I really only know their dogs' names. I don't know their.
I know. We actually one year we started keeping a sheet, so we would just know who the owner. We knew all the dogs. We didn't know
I know Brandy's mom, and
Uh-huh.
and Sir Arthur's mom, and But I think those are the things that bring us together. I think anything that humanizes us and that brings us together in common allows us to work through these really important issues together. You also talked about the importance of the early impromptu peer mentorship that happened at Hopkins, and so that's certainly something that we want to continue to replicate and to seed, and we do through our Advanced Advocacy Academy and our Liver Action Network. But I just really want to join you in underscoring how important those peer mentors are to, encourage people, to give people hope for that next step, to help people problem solve. It really is an important part of medical care.
It is. After the transplant, for a couple of years after that, I started doing a mentorship at Hopkins with other patients that were infected with HIV and HCV. And we were trying to get them into care to be treated for the Hep C, which a lot of them had reservations about taking this drug or everything. So it was more like a buddy system. So we would need them taken to the appointment, talk through whatever problems they had and everything. And it was very worthwhile. But, I have to say that I met a few people there that, they couldn't tell their relatives even that they had hepatitis because they were afraid of being axed out, just cut off of their life. And I've never had to deal with that. I've been fortunate. But for those people, I don't know how to reach, because you're not really reaching them. You have to reach their community. And I still think, like if more people, if becomes more normalized, that it's just what we do in life. If you get sick, you get treated, no matter what it's for.
Exactly. Exactly. I drive a hepatic burgundy car with Liver Lady license plates, so that wherever I go, people feel comfortable coming up and asking. And I also know that I'm not ashamed of having had a liver disease. And so I've gotten, so many questions from, garage attendants to Vietnam vets, approached me as I was getting the car after an event, to someone who was come to the wrong house as they were house hunting and then came back an hour later to ask, does that say what I think it said? And so I think you're absolutely right that we just need to make it a normal part of conversation. That, if you have a liver, you're at risk of a liver disease, and it doesn't matter what else there is about you, that we're all in this together. So
absolutely,
I think that's an important message. So as you said, it's been a decade since your liver transplant. What would you say to someone who is just starting on their transplant journey? What is it that you wish that you knew?
What I wish that I knew. Actually, well, before I had the transplant, in the beginning, even I would go to these. They had Trio, Maryland would have these seminars about once a year, and it would be like 8 different programs, and then you would break out to what program you want. And I met a lot of people there, got to talk to a lot of people, and that really helped. And I think going and talking to those people and seeing the different avenues that you have to take, plus you'll meet people there that may be in a like experience like you, because there's so much to know. Yeah, I mean, it's like you don't know sometimes where you. I mean, at first I was listed in Pittsburgh. I didn't know like if we were going to have to rent a house, because you have to. There's all kind of different things that you have to, and it sounds overwhelming if you wait till the last minute. Where I think if you can try to get a heads up and at least start your plan A and maybe a plan B ahead of time, that all helps to keep it so it doesn't get crazy. That you do have plans. And I think you can get that information when you go to those people and talk to them, see how other people are doing.
I think that's great advice. And I would be remiss if I didn't brag a little that the current president of National Trio is Lorinda Gray Davis, one of our A3 alumni. And,
good.
And we're extremely proud of her and her leadership. So yes, so go find a local Trio meeting or another meeting organized by your hospital or by GLI, so that you can meet others who are going through this. There's no reason that you have to be alone.
No. And another thing I will add, you are your biggest advocate.
Yes.
And you have to speak up. And that's, don't be afraid to ask questions. And there are some questions you don't need to ask the question, like how long do I have or anything like that. You don't need those questions. Just keep hope, stay encouraged. There was between transplants, when I was in the hospital and I was in a coma and everything, there was a man that used to come in. I think he did the supplies, and he used to tell my sister every day, stay encouraged, stay encouraged. And she told me that after it was all over and when we were leaving, she introduced me to the man. And I always think of that, stay encouraged. And you do. And you just have to advocate for yourself, stay on top of things, get the information that you need. If you're not sure, have a good relationship with your doctor. I just think being in good touch with your doctor. If you don't like him, or her, if you really, it's not your fit, then try to find another doctor, because you really are. They are a partner with you. The ones I have met, they've been wonderful people. They're caring and they're human just like us.
Absolutely. Morris, I'm going to thank you, and I'm going to end on the words, stay encouraged.
I like that.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.